Are you going to be able to read the comments?
Oh, yes.
Oh my goodness. Okay.
Where are we? There we are. Hello, everybody. And Happy New Year! There we are. Happy New Year 2023. Let us know if you're watching. I should think you've all given up. And
Yeah, you've all gone, I expect. We just didn't know what Facebook wanted us to do, and it needed us to write something in a box, and we've worked it out now. Hopefully we won't be next time.
I'm just seeing if we're live. I can't see any. There we are. We are live. Yes. Fantastic. And let us know if you're watching. I'm Naomi, one of the infant feeding midwives.
And I'm Hannah, also infant feeding midwife.
And we're going to start the new year. We're probably going to do these sessions every other week into the next few months. So hopefully you've got questions for us after, I think it was the middle of December, wasn't it, when we stopped? So at the middle week in December. So we are talking all things infant feeding.
Yeah, so we'll be with you every fortnight on a Wednesday at 12 o'clock, and hopefully we won't be late next time. So this session is about infant feeding anything. So if you're breastfeeding, if you're exclusively breastfeeding, if you're mixed feeding, if you're giving bottles, or if you're pregnant and
or
thinking about how to feed your baby,
if you're starting your baby on solids, all of those things are part of this session, and you can ask anything you like. So no question is too silly, and we would love to hear from you. We've always had the most amazing questions, so hopefully we will continue to have that. I'm not sure that anybody is watching us at the moment.
We've got 8 viewers, it says. So hello, 8 viewers. Thank you for being really loyal and waiting. Or if you just
something's happened. Something's happened with the blogging that's slightly different to what we were doing before. So that's why we've been struggling a little bit. But hopefully you will be able to post your questions below. So put them in the comments below. Let us know if there isn't that facility and you can't do it. Well, you can't, can you? That's the problem. It looks like there's a comments session. Yep. So you can comment and ask your questions. So we'd love to hear from you.
We thought we might start by talking about a few topics, so that you're not just listening to us bumbling. But we thought we might talk about some changes that you might notice during pregnancy if you're pregnant and waiting for your first baby or another baby to join your family, and then changes you might notice in your body and especially in your breast, because we're talking about infant feeding. So most women find that they get some kind of changes in their breasts, but like all things hormonal, like our periods and everything else, they can be very unique to you. So don't worry if you're not getting the same type of symptoms or changes that your friend is getting, because it will be quite typical to you and even to that pregnancy. So sometimes you get a lot of discomfort in early pregnancy, and if you speak to women with multiple children, they sometimes get it in one pregnancy but not in another pregnancy. So it is really very typical to that pregnancy. Usually, often the first sign of pregnancy for women is that they get breast tenderness. So that's already the body, the hormonal changes affecting your breasts that early on in your pregnancy. And most women find that they start to get some fullness in their breasts towards the end of pregnancy, and in the very last few weeks of pregnancy, women find that they start to leak a little colostrum. Sometimes when they're in the shower, and sometimes it's just really clear, or sometimes it's yellow or cream coloured, and any colour is actually fine. But usually clear or cream or white.
Can be greeny coloured as
well,
can't
sometimes.
it? Sometimes.
Yeah.
And in the beginning it can be slightly pink, can't it?
Yeah, especially if it's your first baby.
Yeah.
But obviously, if there's anything you're worried about, then get hold of us. Our contact details are on our webpage. But also, on the other hand, and this is really important, if you don't leak and you don't see any colostrum, it doesn't mean you won't be able to breastfeed. So some women need that big hormonal shift of the placenta coming away, the afterbirth, after their baby is born, and that gives the brain and the mother's body the massive signal to actually start milk production and to divert all that energy she's been using to grow her baby into making milk. So for some women, they won't leak at all. You won't see anything at all coming out of your breast, and it does not mean you can't breastfeed. It just means that you're one of those women where you don't, but you will once your placenta comes away. So don't feel worried if you're not seeing any colostrum.
And that's if you're doing hand expressing as well, isn't it, in the antenatal period, because some people don't get anything out when they hand express and they're learning to hand express. And you know, we talk a lot about hand expressing early in the pregnancy beyond 37 weeks. So, and it's not necessary that you have to collect colostrum, but actually it gives you a fantastic skill for when you've had your baby. And it's one less thing for you to worry about. So it's about
having a
learning a new skill and having a go. So you might only
learning
want to
about
do
your
it
own
a couple
body.
of times. You don't have to collect it and do it, you know, 4 times a day, which is, you know, what some mums do. Particularly if you know that your baby's going to be separated from you, or you're going to have some problems, or you've got a medical history. And I think.
Yeah, so if you have diabetes, or
Yeah.
you know, or you're expecting your baby to be a bit early, or you're expecting something a little bit out of the ordinary, then it might it might be worth just experimenting and seeing if you can collect a little bit of colostrum to bring in. But if you don't anticipate any of those issues, or if it's your first baby and you don't have any underlying diabetes or anything like that, it's not a must, it's not something you have to do to be able to breastfeed. So you just come in and you'll be fine. You don't have to collect your colostrum. I wonder if might be an idea just to demonstrate hand expressing.
Yeah,
I think that would be
absolutely.
helpful for people at home who might be either home with a very little baby or pregnant. So everybody's breasts are different. Women with really tiny double A cups, some women from Southeast Asia with very small breasts, they all breastfeed fine. So, and women with bigger breasts also breastfeed fine. So please don't be concerned if you have very big or very small breasts. It's just about getting the right support for you after your baby's born. But your breast will produce the right amount of milk for your baby. If you have very, very small breasts, you just may find that your baby feeds a little bit more frequently. So, but you'll definitely be able to produce milk. So before you start hand expressing, obviously just have clean hands. You don't have to alcohol them or, you know, disinfect them. Just nice, good, warm, soapy hand wash and a rinse. And then just start having a look at your breasts. Maybe even do it in front of a mirror, so you can sort of see how your breasts hang. Some women's breasts hang quite low or high. Sometimes the nipple points out to the side a little bit on one side and straight forward on the other side. So our breasts are not symmetrical at all, and that is normal. So everybody has one bigger side and might have a nipple pointing one way or the other. So that just helps you a little bit once your baby's born to know your own body. And then you can start off by doing a little bit of breast massage. So that can be stroking down. It can be a little bit of gentle squeezing massage with your hand on your breast. Try and be in a nice warm environment where you don't feel like you're going to be disturbed. Some women find it good to do it in the shower or the bath, where it's nice and private and they feel warm and comfortable. So anything that feels good to you, there's no prescribed way. And the idea of breast massage is, it just before you start hand expressing, is just to get the hormones flowing. So like babies do, they kind of grab your breast and pummel a bit.
If you've got a baby, you can do skin to skin.
That's true. If you've got a baby, they can do it for you.
Skin, and they will really whack your, you know, hormone response up.
Yeah, that's the best oxytocin driver, is your baby. But if you're pregnant and having a go, then a bit of gentle breast
that
massage.
you relax as well, though. So it
Yeah.
might be that you know, stroke your pet or have a cuddle or something like that, you know, and then wash your hands, obviously. But you know, it's something that makes you feel relaxed and unobserved and safe. And I think that, you know, oxytocin is a really shy hormone, and it responds, you know, very shyly to lots of stress. So try not to do it when you're stressed. Oh, have we disappeared?
I don't know. It wanted us to do something. I do apologise. It said action needed, which sounded really urgent, so I clicked on the button. Yeah, so after you've had skin to skin with your baby, or you've done your breast massage, then you can start to hand express. So you may even find when you're hand expressing that a bit of doing the breast massage, that a bit of colostrum starts to leak from the nipple. So the nipple is the pointy bit in the middle of your breast, and then you have a pink or a dark area around the nipple, and that's called the areola, and it has some little scent glands on it, some little bumps, and then you have your sort of normal skin all across here, here, and underneath is all the fat and the milk producing cells. And so you can touch your nipple, or if you can bear it, a little bit of a tweak on the end of your nipple, and that will really boost your milk producing hormones and help the milk be released down to the breast. And then all you do is make a C shape with your thumb and your forefinger like this, and then start at your nipple and feel backwards towards your body, and you will find maybe a change in texture. If you can't find the sort of change in texture, don't worry, just go sort of 2 to 3 centimetres from the nipple base, and then all you do is you sort of press down together, keeping your fingers in one place, so not sliding, because that will hurt your breast, but just keeping them in one place and squeezing quite firmly together, not so it hurts you. If it hurts, it's possible that you're too close to the nipple, so move back towards your body a little bit, then you might find a comfortable place.
Well, sliding is something that most mums do when they start doing it, and that's why they say often they don't get anything, is actually that they're not actually getting into the breast and stimulating the ducts in the right way. So be careful that you're not sliding. And it's something that most mums do with their fingers flat, and they just slide their fingers forward, and that doesn't actually tap into those ducts as effectively. And it's one of the most common things that we see when we're teaching hand expressing or going to talk to mums about hand expressing, and they haven't, we've been asked to go and see them because they have no colostrum. It's one of the reasons why is that they are actually just rubbing.
Yeah, sometimes it's technique, isn't it? And,
Very much
and that's
so.
where it's nice to have a little go
really
and find out where your
ducts.
particular sweet spot is, because everyone's different. But like Naomi said, your ducts actually never move, so moving your hands around a lot isn't really going to do anything. You only want to be over the ducts, and the ducts don't move, they stay in the same place. So once you've found that comfy spot where there's some milk coming out, then you just stay in that spot and press your fingers together firmly and hold for a few seconds. And I think that's the other thing we see, don't we, Naomi, is
quick.
If you're doing it too quickly like this, it doesn't give a chance for the colostrum to reach the surface of the nipple. Yeah, it's really thick. It's kind of like glue, isn't it?
Yeah, really
so colostrum is much more viscous and sticky than mature milk. So in the first few days, it does take a little while. And I know this is a horrible analogy, and you're never going to be able to get rid of this mental image.
Exactly what you're
but it's a little bit like squeezing a spot. But yeah, you do need to hold that squeeze for a few seconds. 1, 2, 3, let go. 1, 2, 3, let go. And that way it just gives time for the colostrum to travel, enough pressure for the colostrum to travel out of the ducts to the surface of your nipple. And the surface of the nipple has many holes, like a watering can. It's not just one hole. And I know I'm probably telling you something you know, but
just in case
a lot of people don't know that.
Yeah.
They think it's one hole. So you have multiple holes in the end of your nipple.
It's always a surprise when your milk comes in and you hand express and it goes
shooting out the side.
And actually, we've got a really good video on our infant feeding page, which we have got QR code coming.
Yay.
It's all done, set up, and that's going to be stuck into your notes and into your care plan very soon. And you can just go onto that, and it links you straight to our website, which means that you can then log on to these videos, and it shows a mum in real time hand expressing, doesn't it? And her milk just comes in and it squirts across the room and takes her by surprise, because the milk's just transitioning on about day 3. And so it shows you how that happens. So it's really, it's nice to watch that to reassure you that it's going to happen.
And colostrum is only tiny, tiny little drops. The average colostrum feed for a baby is about 0.6 of a mil, so it's extremely small. Naomi's going to show you in a teeny weeny syringe
so that's
how much it is.
Tiny. So that's
and that is
6
all your
notches
baby
here.
needs
That's
for the first couple of days.
That's a lot of colostrum.
It's
Most
like
people
golden
just get
syrup.
this much, 0.1 mil when they start, if that. It's drops. And we collect in these syringes because it's such small volumes, and so if you pump, it just gets stuck to the equipment before it's even reached anywhere.
But you can use a teaspoon, can't you?
You can.
Or even just straight into your baby's
Yeah.
mouth, so that they
Yeah.
know where it's coming from and they can just lick it off. So it doesn't have to be in a syringe if you find that tricky. But if you're going to store any of it to bring in, then you could ask your community
Midwives
midwife
can give
for
you one
some
of these.
syringes.
They do have bungs on some of them, so make
That's really
sure
handy.
that you take that off before you give it to your baby. We have had an incident in the UK where it wasn't, and the baby had it
Yeah, because
inside
they're
them.
quite small.
So they're
The
little
bungs.
tiny bungs. So
Yeah.
make sure that yours hasn't got a bung on, and if it has, make sure you take it off
Mm.
before you put it in your baby's mouth. That's really important to know. But it is tiny volumes, and you can show how to
Yeah.
collect, can't you?
So
It's, if
you
you do
just
it
would
yourself, then you can
squeeze
together
together.
to be on your own. It's a real technique.
So, as nurses and midwives and doctors, we kind of take for granted that we can work a syringe with one hand, but it's actually not that easy, I guess, if you've never done it before. It's actually a really unpleasant feeling to have a syringe scraped across the front of your nipple. So, if you want to express it into a
Carefully.
spoon first or something, then you can do that. Oh, we've got somebody wrote a message. Hello, Louise. Yay! Somebody's joined us. Hi,
Oh, I haven't got the
Louise. Thank you for
message
writing. Yeah, so you can collect it, but you can just collect it in a teaspoon as well. So you basically do that kind of hold for a few seconds, let go, hold for a few seconds, let go, and you do that until the drops don't come anymore, and then you can move your hand around a bit to a different position, see if you can reach any more ducts, but again, no sliding, just staying still. And then once you've done that, you can go to the other breast and have a go, and then generally speaking, you'll get another little bit from the other breast and another for the other, so twice on each
Starts
side.
to flow, doesn't
Helps
it, by
that
doing that
if you're
stimulation.
expressing for an actual baby. If you're still pregnant, just do it until you feel like it. Sometimes it can cause some Braxton Hicks contractions, just because some practice contractions, just because when you touch the nipple, it releases some hormones that give you some tightenings, but they're not dangerous. There's no evidence to suggest that hand expressing is going to put you into labour. If only it were that easy, we would do away with all the drugs. So it definitely won't.
With other babies while they're
Yeah.
imminently due, but actually. In terms of protection, we don't recommend that you do hand expressing
And the
until 37
womb
weeks,
has
so.
a blocking. It blocks the action of oxytocin until the time is right in the normal pregnancy. So please don't worry. If you get a few tightenings, you can just stop. Yeah.
But we don't recommend you do it before 37 weeks for that reason, because
You can practice from 36, can't you? And then
and so just make sure that it's a really good skill that you can learn, and if you're not sure about any of those things, you can contact your midwife, or you can contact the infant feeding team, and particularly if you've had a previous problem. So if you've had breastfeeding issues in the past where you struggled last time and you had problems feeding, you're a prime candidate for having a chat with us before you have your next baby. And also if you've got medical problems, so you might have polycystic ovarian syndrome, you might have things like inflammatory bowel disease, and lots and lots of allergies and things like that. And it's really good that you can stimulate your breasts and know how to get milk from your breasts as soon as you need it, so that you can really stimulate your breasts to produce as much milk as possible, so that the risks of giving your babies supplements is lower if you get on and stimulate early. But everybody should do it. It shouldn't be just people that have got problems. And you should be obviously the first port is to feed your baby at the breast, and if you can't, then the hand expressing is your backup. That's your emergency care.
And once your baby's born, a bit of hand expressing here and there, it never hurts. It will just boost the hormones and boost the milk supply, and tell your brain to produce milk, tell your body to produce milk, because it'll say, there's a baby here that wants milk, and that will help to boost the process. So it never hurts to get hand
Particularly
expression.
the first few days when your baby might be a bit sleepy,
And
you've had a long labour, you've had a cesarean, or forceps delivery, your baby may be separated from you. And so, 8 stimulations in 24 hours to really boost your supply, particularly if you've had problems before and you've had supply issues before. You need to get onto that stimulation really early on in your breastfeeding experience. So if your baby's only fed 3 times in the first day, so that's day 0, and very sleepy, if you've got time and you feel okay, then do some hand expressing to really stimulate in between those feeds, because that really puts the order in to make lots of milk. And then you're on your front foot. You're getting lots of stimulation going in the early days to keep you breastfeeding for longer, to make sure that you have a really secure supply. And there's just a window, isn't there, in the early days, so we don't know exactly what everyone's window is, but it might be 3 days, it might be 14 days. And if you don't do that stimulation in that time, it gets harder to make milk after that.
So we have a sensitive period after the baby's
Yeah.
born where your brain needs to be told that the baby wants to remove milk. And earlier that you breastfeed your baby, which
Close
is
to the
ideal,
birthday.
so within the first hour after birth, then that's the best. And if you can't for whatever reason, then hand expressing will also do a similar job to stimulate your milk. Naomi Louise has come on and asked us about her baby who's exclusively breastfed and is 6 months old. Louise, amazing. Congratulations.
Well done, you.
What a journey.
Yeah.
And you're trying to get your little one to take a bottle, and it sounds like the occasional bottle's not working out because little one is chewing on the teat when you offer it. So it sounds like maybe your little one's a bit confused about how to make the bottle work because it's only ever known how to make a breast work. And when babies feed from the breast, they only ever suck once, and that's why we call it suckling. It's different from sucking. So when babies latch onto the breast, they only ever suck once when they draw the nipple into a teat shape into their soft palate. So if you feel your mouth, you have a hard palate, and then right after that you have a soft, squishy, soft palate. And that's the only time a breastfed baby sucks. They suck that nipple into a shape into their soft palate, and then from that moment on all they do is compress. They open and close their jaw, a bit like when you suck a cup onto your face. They just create pressure by opening and closing their jaw and using their tongue, and so just like you do when you hand express. So that's probably, I know that's not helping you to get your baby to take a bottle, but my guess is your baby's struggling with a couple of skills babies need for bottle feeding. One is that actual sucking each time it wants to take the milk, which will be very unusual for your baby. And the other thing, your baby might be struggling to make this shape, which is to purse this muscle to make a round shape.
They say that a
seal.
straw is the closest to breastfeeding. So your baby's 6 months old, isn't it? And if
Yeah,
maybe that doesn't
so-
need a bottle, it could drink from a straw.
Well, this shape like this is very difficult
Yeah.
for breastfed babies to make the small hole. So have you thought about offering your breast milk in a cup for your little one? Because a lot of breastfed babies, especially of about 6 months old, will feed much better from a cup than from a bottle. So I wonder if you've tried that. I don't know if you can let us know in the comments, because you may find that your baby takes it from the cup. If you're leaving your baby to go to work or to go out, a lot of mums, a lot of breastfed mums experience that their baby will just not take breast milk from anything until they get home. So often they will drink other things at 6 months, like water, or diluted fruit juice or whatever from the person who's caring for them, either out of a sippy cup or a cup. But often they don't actually want their mother's milk from a bottle or a cup. They just, to them, it doesn't work for them, and they wait till you get home to feed. So the only thing that they'll be absolutely fine long as they're drinking something from a cup. So if your little one's drinking well from a cup, you don't need to worry. The only thing you might need to do is express while you're away to make sure that you don't get uncomfortably full. But at 6 months, your breast milk supply will be extremely stable. So you can go for quite a long time, for quite a number of days, without affecting your milk supply. So that's really important to remember. It's not like the early days we were talking about just now, where you really need to be expressing very frequently to put the order in for the milk. When your baby's 6 months old, that mechanism of milk production is extremely strong, isn't it?
Very much
It's
so.
very
the memory is there, and if you miss a feed and you feel that your supply's gone down for any reason, or you've been poorly, say you've had a bug or something, when you start feeding, that milk supply will come back very quickly. If you feel that it's gone down, you can make it back to where it was. You can't make necessarily more than you've got, but actually you can make it back to where it was always. So you've got that. It's gone from endocrine to autocrine system, and so it becomes just spontaneously produces that amount, and it knows that it needs to produce it for one baby because that's what you've been told.
And good luck, Louise. I see that you've come into the comments saying that you haven't tried a cup quite yet. I think that definitely is the way forward. The breastfed babies are very good at drinking from a cup because it's the same skills.
You don't need to do bottles. There's this thing that you have to give your baby a bottle if you're not breastfeeding, and actually babies don't need to have that once you start to wean them. They're quite capable of taking foods as we do, say with a cup or a spoon or anything. They can just sip as long as they're suckling. They're actually doing it themselves and they're in control. But when babies are younger, they can't. If you give it in a cup, they feed very differently in a lapping way. But actually, as they get a bit older, they take it slightly differently.
We've got lots of. I hope Louise, I hope that is helpful. I know it's sort of not a magic wand for you, but I would say if you've not found La Leche League, there's a really active group in Oxfordshire. La Leche League is the biggest international breastfeeding charity in the world, and we have a great active group in Oxford, and they have a lot of experience with slightly older breastfeeding babies, so I'm sure they would be happy to hold your hand and help you a little bit with that. Just you can bounce some ideas off one of the La Leche leaders around helping your baby go to cup. So,
it's peer support, isn't it?
It's mother-to-mother support. So it's really, really good.
Which is really helpful.
Yeah, let's see someone.
So
if that's okay, Louise,
we'll
see who else is on.
And she said, is it recommended to hand express prior to baby's birth? I think we answered that question.
Yeah, so only if you anticipate a problem, Aga. So
or you want to try it.
Or you just want to have a go and see what's there. But there's no need to actually collect it unless you have a problem or you anticipate a problem. Or if you had a difficult breastfeeding journey the time before, sometimes women feel more comfortable if they've got some colostrum ready to feed the baby. So it really is not necessary for any normal woman who hasn't got any problems, is having a very low risk healthy pregnancy. Absolutely do not worry about hand expressing at all. You can have a little play around and learn about your own body and see if there's anything there, but please don't worry about collecting anything unless there's a specific reason. If you're unsure whether it applies to you, then you can always talk to us or talk to your community midwife just to check whether it would be a good thing for you, or your health visitor. Yeah. I hope that answers that.
So Tony has come, I want to breastfeed, however, I also want to pump. I know there's varying advice about when to start pumping. Friends of mine left it for 6 weeks and advised, and their babies never took bottles, so they stuck to breastfeeding. Is it best to just pump straight away once home from hospital?
It's a really good question, and I think the really honest answer is your baby is just as much an individual as you are. Some babies, if you introduce a bottle early on or early-ish alongside breastfeeding, they make the swap between the two and they can feed from both. And some babies will get very confused. They will find it very hard to swap between the fast continuous flow of the bottle and making that pursed shape and going to the slower, more pulsatile flow of the milk that comes out of the breast with that very wide mouth. So the reason that we say generally delay until 6 weeks is because of the danger. If you want to breastfeed, it's just that small possibility that baby might find it difficult to swap between the two mechanisms. So that's the sort of thinking behind delaying introducing a bottle, just because we don't want to disrupt that very important learning of how to breastfeed effectively. Some babies can do it and some babies can't do it as well. So it's really about, I guess, to be honest, it's really about seeing what your baby and how important it is to you to introduce a bottle. If that's absolutely important to you and you're willing to possibly interrupt that learning how to go onto the breast properly, then you could introduce both before 6 weeks. I think that it might be certainly worth, if you're thinking about that 6 week window, worth delaying introducing the bottle as late as possible in that window until you're really sure that your baby's breastfeeding really effectively. And I think once your baby's breastfeeding really effectively, then you could feel more comfortable in starting to introduce the experience of a bottle. Would you say that?
Yeah, I think the thing that we see most in babies in clinics and things is that they are flow confused.
Yeah.
Because they've had early bottles for medical reasons. A lot of it they've had to have a baby's
supplementation,
needing to have more food for any reason. They're jaundiced, whatever the reason is, and
then
they want to breastfeed and they want to exclusively breastfeed. And when the supply is low as well, then babies don't go to
They
the
get
breast
very, very
happily. They get
frustrated.
really cross, and they don't get the hit that they need as they've had from the
So-
bottles. So that's the
Yeah.
other side to it is and you've got to remember that as infant feeding team, we see problems all the time,
Yeah,
and most
we do
people
see them.
don't have problems. Most people manage to do breastfeed and work it out themselves and make their own rules up, because there aren't really any rules.
Yeah.
You can do however works for you as a family. But the things that we see the most are flow confusion and low supply. Those are the two things that we have problems with, because once it's sore, the baby hasn't attached in the early days. So, you could look at the complete other side of that then they end up just having bottles and they can't get onto the breast because they're not happy to do it. And then other babies just don't care what goes in their mouth. And you
They're
don't
very
know until
motivated
you've got
to
your
eat.
baby,
Yeah,
which baby
and
you've
all your
got.
children will be different. So
Yeah.
just because one baby did it one way, it won't necessarily mean. And mums who have multiple children are both sitting at home going, but they all are completely unique individuals. So it will very much depend on your baby and their skills and how
And
they.
your skills. I mean,
and how
if
the
you've had a
birth
baby
goes,
before,
everything.
you're really confident. You know that your
Yeah.
baby's not going to break. You know which way round to hold it. You multitask. You're already used to being tired, so you don't feel quite so sorry for yourself.
Overwhelmed,
Like you do with your first baby, and you've
It's
had
hard.
no
It's a
sleep.
massive transition, isn't it? Every time,
Biggest
but
shock in the
especially
world.
biggest
thing you'll
very
ever do.
exciting. Very
So
exciting.
you just have to go by what you're finding. How
Yeah.
things are, and
I would
see how
say
it goes
delay
for you.
it. I would say delay it as long as you feel comfortable for. Delay it until you're happy. If you really want to breastfeed as well, I would delay it until you feel like, my baby's really got it. They're really attaching reliably and drinking from the breast. That would be the time, maybe. But if you want to talk through it more, then you could talk to your community midwife, or you could talk to us. So we would be happy to talk about your individual situation through with you, if that's something that you would like to do. I realised, Naomi, we forgot to say Alex is absolutely fine.
Yes, I was looking at Hello,
Alex,
Charlotte.
thank you for bringing
We
that
missed you at the
up, because
very
we were
beginning.
so
I was
struggling to
going
get
to say,
on, weren't we?
yes.
She's on a career break,
She's having some
so
time off.
you'll see us for a
So
while.
we're going to be doing that for a bit.
Yeah, she's
But
just on a
she's
career
fine.
break.
She's
She's
absolutely
fine.
Yeah, she's
Thank
just
you for
having a bit of a
asking.
break,
We shall
and
pass on
it's
your
lovely to hear from
comments.
you, Charlotte and Alicia. So Macy has called in or written in and said, "Hello, my baby is formula fed and I'm wanting to try breastfeeding." So we probably need a little bit more information.
How old's your
Macy, how
baby?
old is your baby? Is it in the first few days, or is it quite old? And have you done any pumping or anything? I think it's very difficult to do personal information, but we can do generalised. But so if you've got any issues and you're still under the midwives, then contact your midwives, and when they see you, then you can talk about it, or you can call into the infant feeding team to support
she's
you.
4 weeks. Was it Maisie? Yeah.
Maisie, yes.
Hi, Maisie.
So your baby's 4 weeks, and have you
Congratulations.
done any breastfeeding at all before? Are you giving your baby any breast milk? Because as we talked about a little while ago, the closer you are to the birthday, the easier it is to make milk.
So, I mean, at 4 weeks, you're still within that sensitive 6-week window,
Yeah.
and your breast will still be extremely sensitive to being stimulated. So, if you want to breastfeed, then the important thing is, if your baby will attach, lots of skin to skin and attaching your baby all the time, that you can manage it, when you're lying in bed, when you're sitting on the sofa watching TV, any time that you can get your baby to suckle at your breasts will tell your brain that, actually this baby is asking for milk from me. And if you really are able, then pumping using a double electric breast pump, hospital grade breast pump, with some compression as well on your breasts while you're pumping, and that will also really boost your milk supply. And what you might find is, if you've been giving a lot of formula, a lot of bottles, that there won't be anything to start with, or there may just be like 1 or 2 drops. But breastfeeding is really one of those things where if you keep it up, your body will get the message, especially if you're in that sensitive time period. And you may find that if you've done no breastfeeding at all, you might find that you will not build a full supply.
Yeah, she said
But,
she's not done anything.
you probably won't build a full supply, but you may be able to build a small supply to go alongside the formula milk. And remember, any amount of breast milk you're willing or able to give your baby helps your baby, because it's not just food, it's got massive of antibodies and stuff and chemical messengers that help different parts of their bodies grow. And it will also help to break down the cow's milk protein in the formula and help them absorb their formula better. So even if you're getting little drops, then that's brilliant. And the other thing to remember is if you can get your baby to attach to the breast, they're actually much more efficient at milking the breast than a machine. Because a machine essentially just sucks, and as we spoke about before, that's not really how the breast works. The breast works by being compressed, so hand expressing is actually much closer to how a baby feeds. So a double electric pump is the best for really stimulating your supply, but it doesn't work in the same way. So getting your baby to attach and feed is really useful. And actually breastfeeding is weird because it doesn't like regular times. In the old days, we used to say, breastfeed your baby every 4 hours or whatever, and that's why a lot of women didn't have enough milk. But actually, like our foremothers did, our ancestors, they'd feed the baby when the baby looks at them, when the baby cries, when the baby's upset, when the baby is cuddling. So actually, breastfeeding works best when it's very ad hoc, when the breasts surprise your breasts. Yeah, yeah, we say that.
And I said it to the staff on the ward
challenge your
before
breasts.
I came, so that you really spike your hormone response to have a much better response. And we know that mums that breastfeed 3 hourly for months and months, if say they're separated from their babies and they haven't done breastfeeding, they've had a premature or sick baby, their supply drops at about 12 weeks. So we know that long term it's not good for supply, but you will get milk when you express, but actually it's a much better response because breastfed babies don't look at the clock when they breastfeed.
Yeah. And a very full breast will have a large volume of milk, which is less fatty. It gets fattier as the feed goes on, however long that feed may be. But one of the best things for boosting milk production is actually for a baby to suckle or to express on an almost empty breast, because what you're getting is that really fat milk out, and it really, really challenges your breast to produce milk when it's being when you're pumping on a breast that's quite empty, or you're feeding a baby on an empty-ish. Breasts are never completely empty. They're like kidneys. They're always producing milk, and that's why you'll always be able to squeeze a drop out even after you've fed your baby forever or pumped
they're
forever.
never empty. So you drain them, but they're never empty.
And they're not just simple storage devices. We actually know now from modern investigations through ultrasound that babies that some of your milk is actually produced during the feeding, so whilst your baby is feeding. So it's not as simple as my breast is full, I pumped it or fed and it was empty, and then I have to wait for it to fill again. It's much more complicated than that. It's much more like a kidney, and the breast will be producing milk even during the feeding. So I would say, to be honest, if you're really interested in feeding after predominantly formula feeding and you want to breastfeed, that you need to see whether your baby will attach, and that's the best, and put your baby on there all the time. You can get the opportunity to do it
after a feed maybe, so they're not so cross.
Yeah, and pumping, if you're really wanting to do that, and you can buy pumps or hire pumps. You could look into La Leche League again, or Oxfordshire Breastfeeding Support if you wanted to talk through a little bit more. Lots of women manage to do what we call relactate, so it is possible. And there even women who have never been pregnant before, who are adopting a baby, can produce some amount of milk for their adopted baby. So for some women, you don't even need to have been pregnant. So you're in a strong position, Maisie, if you've been pregnant and you're still within 6 weeks. I think if you really feel strongly about trying breastfeeding, we would absolutely encourage you to get the support and have a go.
Skin to skin. Feed your baby when you're giving your baby bottles. So you can feed your baby skin to skin. So strip off, both of you, and allow your baby to be close to you, because that will get your baby used to being close to you. If you're feeding and your baby's not quite so close to you, or other people are doing it, which we don't encourage. We have, we sort of have designated feeders in a family so that they know who's going to be feeding them. But if you're wanting to breastfeed, make yourself so that your breasts are exposed and your baby is used to being with the breast as well as having a bottle, so they're close to the breast when they are having a bottle. Then it will be normal when they are going to the breast to be close to the breast. So it might be that you start feeding, maybe do some pumping before you start hatching even, or do both or whatever, but start the process of creating milk.
Stimulation
so
is the most important
when
thing.
they go to the breast they get something as a positive feedback, they'll go back. But if it's a negative experience and they don't get
Make it
anything,
nice.
they won't say, well, what's in it for me? I'm not getting anything from here. So sometimes at the end of the feed, when they're just a little bit unsettled, putting them to the breast after they've fed is a good time to
encouraging
do it,
your
so they're
baby
not
to
hungry.
comfort suck at the breast will
Yes,
do
exactly.
more for your milk production than anything else, because it's that hormonal feedback that you're getting as well. So instead of giving a pacifier or a dummy with your bottle fed baby, Maisie, try and start getting your baby to comfort suck at the breast, and that's a really good way of them getting used to using the breast. And the likelihood is you will produce a small amount of milk to start with, so you may. The thing to do is listen out to hear if you can hear some audible swallows. So when babies are breastfeeding, if it's a very quiet environment, you can hear a kind of sound, and that's when they're swallowing milk. And so even with a small amount of milk, you will hear a swallow. So that's something that you could start listening out for. I think knowing when you're making a full feed is probably applying bottle feeding thinking to breastfeeding, which doesn't really work. So with breast, it tends to be baby feeds, and they get varying amounts, and then they'll come back to the breast maybe half an hour later and have another breastfeed, or they might have the other side. So it's not quite the same as you're making so many mils for your baby. And also breast milk there's no waste with breast milk, because the molecules of human milk are going to a human baby, so there's very little waste. So you need less breast milk than you will formula as well. So it's not like trying to replace your baby's formula feed with a breastfeed, if that makes sense. But certainly the best way is listening for audible swallows.
Yeah, so what's in the milk changes it each time, so that it makes the right mix of food for your baby. It's individual to you and your baby.
And it's very clever, because a little bit like our bodies know when we reach the age of puberty and all these massive changes take place, your body actually knows when your placenta is birthed after your baby, your afterbirth, it sets off a biological clock in your body that ticks, doesn't it, Naomi? And so your body actually knows how old your baby is, and it's absolutely fascinating. So human milk will take in and out the things that your baby needs dependent on its age. So we actually know that there are certain components of your breast milk that the levels rise at certain points when your baby's a certain age, and so it's extremely clever. Your body has a time frame and knows how long it's been since you've birthed. So that's why after 6 weeks, the volume of breast milk that your baby takes from your body actually doesn't increase at all. The components in it change, and that's just amazing. So I would say, Maisie, get the support if you really want to give it a go.
Go to the infant feeding page, because there are some videos on how to pump as well, and some information there, so that you can watch that as well, and that will help you. But there's there is lots of help out if you want that support. There is people will fall over to help you breastfeed if that's what you want.
And it's lovely to be able to just, regardless of how much milk you're making, it's lovely to be able to offer your baby that comfort if you're comfortable with that. Lovely to be able to give your baby that comfort alongside their formula feeds. Comfort at the breast. I mean, that's what every baby loves. So we all love a nice cuddle, don't we? So. And they love to suck, as you've all found out. So that just is everything in one, isn't it? A cuddle and a nice suck, and puts them to sleep. So definitely is a nice parenting crutch, breastfeeding. So
we've had a message from Charlotte. She said hi, and we've said Alex is away, but your baby is due next month. I can't believe that you're going to be delivering next month, Charlotte, and having a water birth. She's 2 years and 8 months, Alicia. So
lovely.
Well done you. It's lovely. We're looking forward to that. And hope it all goes all right, but we will be around. Any other messages? Maisie, I'd like to combi feed, so when our formula, but when home breast is that
so
possible?
as we were saying, they
sort of
complement each other. Your breast milk will help your baby to use the formula. So definitely, I mean, any breast milk you're able to give your baby will definitely help them. We know that breastfed babies have different slightly different physiology. So breastfed babies have a bigger thymus gland in their neck than a formula-fed baby. So there are certain actual biological changes that happen because of the human milk. So human milk's not just food. It has some chemical messengers in it that tell your baby's body what to do. So it tells your baby whether to grow certain cells in certain organs. It tells your baby what antibodies to produce in their system. It gives your baby hormones.
Larger intestines, don't they? Longer intestines. The large intestine
because
is longer.
There's growth hormone in human milk.
And they've more absorption.
Yeah, so there's lots of, breast milk isn't just food. I mean, it's food as well, but it also is it's an interface between the mother's body and the baby's body, and it gives the baby's body a lot of biological information that it needs to grow certain areas of its body, and that's why there's such a drive to try and support women who want to breastfeed, because that's what the baby's body is expecting, that support. We know that babies who are breastfed for the first 6 months, they take up their immunisations much better as well. So we know that those babies are much more likely to get the immunity they need from their initial immunisations at your GP. They're much more likely to pick up that immunity that they need. And that human milk has a way of boosting that ability.
If your baby is on formula, it will do very well. But we're just sort of pointing out the differences between the two. So if you're listening in and thinking all of those things. Charlotte said you're a bit nervous, but you'll be fine, Charlotte. You've done it once already, and
you said that what happened before. So you obviously had an experience where what was it particularly? I mean, you might not want to share on Facebook Live. I totally understand that. If you'd like to talk to us, Charlotte, please do get in touch.
Talk to your midwives as well. I know that you're seeing them.
Yeah, so talk to your community midwives, or if you'd like, if you think there's a specific feeding thing that you'd really like to talk about antenatally, then your community midwife can refer you to us for a proper appointment by phone before you have your baby, if that's something that would help you.
We know that you had a miscarriage and that you're now next month due, so that's really wonderful, isn't it?
Yeah, it's amazing to think.
We look forward to all the really happy things and what you've got to look forward to. So we've got Alice, she said, hi Naomi, you mentioned that supply can drop at 12 weeks. Could you explain what causes that?
Yeah, I mean, that's more really if you've had a rocky start, so that's,
I'm worried.
And you've been on a very tight schedule. So sometimes when babies are born prematurely and they've been, either in neonatal, or separated from mum, and mum's having to do exclusive
So this is when you haven't been breastfeeding, okay? This is when you're just pumping and your baby's in the neonatal unit separated from you, and you're just pumping 8 times a day, and you get into a pattern. It's not when your baby's suckling.
It's the not surprising the breast
and
that
can
cause that drop.
I see you're saying, so it shouldn't affect you in the same way.
Sometimes at 3 or 4 months, mums get a bit, everything's been going well, breastfeeding the beginning of the journey. I don't know if this is the case for you, Alice, but sometimes it's very
risk because she's had a difficult feeding journey, and I'm triple feeding. You've done so well to do all of that for 10 and a half weeks. Pat yourself on the back.
Crikey.
Pat yourself on the back. You've done so much.
So much. And you shouldn't expect it, especially if you're triple feeding. I don't think you need to worry about dip in supply.
You're talking about mums that have only sort of pumped, never breastfed, whose babies are separated from them, and they're in this neonatal unit long term. And they've been very premature and had lots of problems, and you have to keep your supply going and take your milk into the unit, and we have found that some mums, their supply drops at about 12 weeks.
Yeah, but you shouldn't expect that if you've had a normal journey, or if you've had a neonatal journey but you've really stimulated your milk side and made a really good fill supply, and you pumped during the night and all of those things and worked really hard, which loads of women do when they're separated from the baby. You should not expect a dip at 12 weeks. So it's literally we don't see as much as we used to, did we?
No, because
it's
we
usually
are
when
much
people
more
have been
responsive.
On a strict regime that they see that, so don't worry. And
Don't worry.
some women do worry that breastfeeding's changing at around 3-4 months, and that's actually very normal. So it can be that baby's just becoming a bit more distracted. So around 3-4 months they're smiling and they're becoming quite keen on looking around. They're noticing their siblings, they're noticing other people, they're noticing the cat. And sometimes it's really frustrating for mum because it's almost like baby goes on and just gets the letdown going, and then they're off looking at something. And so 3-4 months can be a
Sometimes
funny
you've had a
age.
period, sometimes you've ovulated, and that changes your supply a little bit
Yeah.
around then. Sometimes you've started on contraception, and that
Yeah.
sometimes dips your supply.
So all
for a
these
few
things can
few days.
change.
So there's lots
Yeah.
of things going on in your life at that time as well. But you've done everything. You've done everything and
Yeah.
more than most
Going to a
people
quiet,
do.
dark room sometimes where baby's not so distracted can be really helpful just for getting them to have a proper feed at that age if they're really, really switched on by people and stuff
Yeah.
and they want to look
Distracted
around.
by
all the
noise,
time.
turn the
Yeah.
radios and tellies off and things.
Yeah.
Absolutely.
Alicia's waving at us.
Yeah, hello, Alicia. Can't wait to meet you.
Wow. It's going to be an
and-
older sibling soon.
I know, isn't it lovely? So I think that's all of our messages, isn't
Yeah.
it? We're about an hour now. It's
Yeah, I'm so
1:15.
sorry about our. I think we'll be much more
switched on
slick
next time.
Yeah.
Because Alex always did it, and
Yeah.
it was already ready and starting to go. But
Yeah,
even
now we've worked it
even
out,
we
I
had
think.
problems at the end because they changed the format on Facebook, and that's why we're struggling because it's all
Mm-hmm.
slightly different to what it was. So really, really sorry that we didn't get there at 12
Yeah,
o'clock.
we
But
could.
in 2 weeks' time we're coming back.
Yeah.
So pass the word and get your
Yeah.
questions all lined up. And we really look forward to speaking to you again in a couple of weeks' time.
Brilliant.
Thank you
Yeah,
very
so we'll
much
see you
for
again
your
in a
wonderful
fortnight on
questions.
Wednesday. And anybody who's had anything, brought up from this conversation, whether you commented or not, if you're sitting at home and you're thinking, oh, I wonder if that applies to me, I'm now feeling a little unsettled, or I'd like to know more, that's really interesting. So any of those things, anything that's coming up for you after this session, please don't, go away.
go and worry.
Get the support. There's so much support out there. Just
And it's free.
yeah, it's free. La Leche League, Oxfordshire Breastfeeding Support, the infant feeding team here at Oxford
Community
University
midwives, health
Hospitals, your
visitors.
community midwives, and there's so much out there. So please do get the support, and any feedback, we'd love to hear it.
Keep those questions
Yeah.
coming. All right, and bye from us.
Bye bye.